What's up, everybody? This is your boy Uber Hikari, aka the Nerd Nigga, here to bring you another video with no frills, just the analysis. And no doubt you clicked on this video because you've looked at the title and said, "What the fuck is this?" I know you're all thinking, "Uber, what the hell is this?" Because I know you're saying to yourself, "This does not fit with any of the other content on your channel." And I'm just going to say, first of all, that this was not a topic that I was going to do a video on. I had not planned to do this. But this is actually a video response to my man Hugo Strange, who did a video. I believe it was, he just uploaded that video yesterday on children and sex changes. And it's basically about, well, his video was basically about this phenomenon of children who feel like it's really weird. Children, basically transgendered or transsexual children who feel like they were born into the wrong biological body. So basically, it's like, you know, if you have a child who's a boy, he will think that he's supposed to be a girl rather than a boy. And so this was a video that, you know, Hugo, who obviously felt, you know, very strongly about this issue because it doesn't even match with the content or most of the content on his channel. And so you could obviously see that he felt very strongly about this. His video is named Unscripted 2, I believe, if I remember correctly. And I'll post the link to the video down in the description box, or, you know, post an annotation on this video. But yeah, this is what this video basically is about, and that's what I want to be discussing. And the reason why I chose to do a video response on this particular topic is because I think this is an issue that's, you know, becoming, as we become more conscious about, you know, gender politics and sexual orientation and gender identity. You know, there's a, you know, big fight going on for gay rights as we speak within this country and perhaps even in the other countries around the world. And so I felt like, you know, since this was somewhat of a contemporary and relevant topic, and this is such a weird, you know, phenomenon of, you know, transgender children, I thought that I would do a video response to, you know, add some greatly needed clarification and to shine some light on this particular topic. So this is also a topic that I feel, you know, quite strongly about. And so yeah, let me just say this before I get into the main body of the video response. Hugo, you're my man. I think you're highly intelligent. I've told you that on a number of different occasions. I really like the content on your channel, but you are just absolutely wrong about this. On almost every point, you're wrong about this, and I'm just gonna have to, you know, go point by point. I'm looking at my outline right now. I think I have. See how many points I have here. I think I have 6 points. 6 points on this outline that we're going to cover. So yeah, I read the Huffington Post article that you linked. I read the Fox News one, and I also did some research on my own. So, you know, I actually, you know, read the actual medical article and not just the quotes of the medical article. So I'll just say that. So let me get into this video response. So first of all, Hugo, you have no scientific basis for your position. No scientific basis whatsoever. No medical basis, no scientific basis, no psychological basis for your position. And I think you're a little bit confused about, you know, what this precisely is. This is not a normal case of, you know, childhood gender switching. Childhood gender switching is a phenomenon documented by psychologists where a child will, you know, take on or adopt the role of a different gender. And this happens very frequently in our childhood. We, you know, like to role play and we adopt different identities, and sometimes we do what's called, you know, gender switching. However, this is not a case of gender switching. Not at all. These children actually feel as if they were born in the wrong body, that they were born with the wrong gender, the wrong, you know, gender physiology. And the proper term for this is gender identity disorder. So this is diagnosable in the DSM. The DSM is the Diagnostical and Statistical Manual of, you know, psychological disorders. And basically, it's a manual, and every, I think, 7 years, psychologists, therapists who are, leading professionals in their field come together and create this manual that basically outlines and documents all of the psychological disorders that, that have been established by them, basically. So this is not just a normal phenomenon of gender switching. This actually has a name. It's actually diagnosable in the Diagnostic and Statistical Manual of Mental and Psychological Disorders, and the name for it is gender identity disorder. So there's a very, very big difference between gender identity disorder and the normal childhood phenomenon of gender switching. They're completely different. Some of the symptoms of GID, gender identity disorder, includes self-mutilation. So some of these kids actually mutilate themselves to sort of force their bodies to match what they think their gender should be in their head. They exhibit cross-gender behavioral patterns for years. So this is a lifelong psychological, psychophysiological condition. It's not just something that happens, for maybe a couple of months in their childhood. This is a documented pattern of cross-gender behavior that is established over years of time. We're talking, 5 years, a decade, like years at a time. You don't outgrow gender identity disorder. The common phenomenon of childhood gender switching is usually a phase that children go through, but they outgrow it. Gender identity disorder, you cannot outgrow it. You do not outgrow it. Some of the other attendant symptoms of gender identity disorder is depression. Because there's a sort of cognitive dissonance between what they think their gender should be and their actual, physical body. They, are more prone to depression, more prone to anxiety, more susceptible to committing suicide, and like I said before, more prone to engage in acts of self-mutilation. So again, childhood gender switching and gender identity disorder are not the same thing. They are, leagues apart in terms of the sort of psychological condition that they have. And they are not confused and they are not delusional. This is an actual documented psychophysiological disorder. They're not confused. They're not delusional. So point number 2, sex change. And this is something, Hugo, that you tend to lump together throughout the video. There is a difference between sex change and sexual reassignment surgery. These are not the same thing, not by a long shot. And again, you seem to lump them together and sort of, treat them as if they're all the same, and they're not. Sexual reassignment surgery generally involves, one of 4 things: the removal or the reconstruction of the penis, the removal of the testicles, the removal of breasts for female, and or the construction of breasts. That's what sexual reassignment surgery is. It is the changing your body biologically through surgery and through actual, operations. It's a physical altering of your body. That's sexual reassignment surgery. Sex change is not an operation. It is not a surgery. It's not a physical altering of the appearance of your body. Although that's one of the sort of the conclusions, but it's not done through surgery or not done through an operation. So there's no sexual reassignment surgery being done on children, not that I'm aware of, and not from the sort of research that I've done online. There's no cases of that. Sex change involves 2 stages. The first stage is puberty suppressant drugs, where you give, once the onset of puberty comes, which is around age 10, 11, 12, they're given puberty suppressant drugs. And basically what this does is it's either, I believe, androgen for girls and estrogen for boys. They're giving these puberty suppressant drugs that stop their body from going through puberty. So instead of surgery or an actual physical alteration of the body, it's a sort of altering of their biochemical makeup that stops them from going through puberty. And this process is completely reversible. In order to reverse it, all you have to do is stop taking the drugs, and then your body will naturally resume the process of puberty, and you'll go through all those physical, and chemical processes that attend puberty. The second phase of sex change is hormonal treatment. And hormonal treatment means that it's a permanent alteration of the biochemical makeup of your body, so that it doesn't just stop you from going through puberty, but it actually forces your body to, if you're a boy, it forces you to develop, secondary sex characteristics of women, and vice versa if you're a female. And this process is irreversible. So it's an actual hormonal treatment that forces your body to go through the puberty process of the opposite gender or the opposite sex. And these are the medical guidelines. And this was quoted from, I believe, the Huffington Post article that you linked in the description below your video. So this is the quote. Guidelines from the Endocrine Society endorse transgender hormone treatment, but say it should not be given before puberty begins. At that point, the guidelines recommend puberty blocking drugs until age 16, then lifelong sex-changing hormones with monitoring for potential health risks. Mental health professionals should be involved in the process, the guidelines say. The group's members are doctors who treat hormonal conditions. So there's a difference between sexual reassignment surgery and sex change. And sex change involves two phases: one, puberty suppressant drugs, which are reversible, and two, hormonal treatment, which is not reversible. All right, so point 3. In your video, you say that this phenomenon of children changing their sex is prevalent, and that it happens between the ages of 1 or 12 months old, as you say, and 5 years old. Not true. I mean, this is just absolutely not true. You're just absolutely misinformed, and that is not factually the case. Now, I did some research on this, like I said before, and I did find instances where 1-year-olds, where their sex was changed. But this is in India, not in America. This is in India. And the situation, the context in which this sex change happens is completely different from gender identity disorder. In India, boys are valued more than girls. And so what women do, and this is, if you read, UN reports about the gender demographics of India, you will see that, what women in India basically do in order to, make sure that they don't have a girl is they go for ultrasound screening, and then if it's a girl, they'll abort the girl. And if they do have a girl, then they'll force the baby to go through sex change operations to transform them into a boy. And there are, all sorts of socio-cultural reasons why women aren't valued in Indian society, or while, girls aren't valued in Indian society. But this never happens in the United States of America. This never happens in the United States of America, and it's never as a result of treating the psychophysiological condition of gender identity disorder. So when you state that this is happening to children from 1 to 5 years old, that is not true. It's simply not true whatsoever. Now, like I said before, you also say that this is prevalent within the United States of America. That's not true either. These are facts. This just is not true what you're saying. Gender identity disorder, the prevalence, the sort of statistical prevalence of gender identity disorder has been estimated at 1 in every 10,000 people. Now, from a percentage standpoint, that's 0.0001% of the population. Now, the population of the United States of America is 300 million. Out of those 300 million, it's estimated that only 30,000 people suffer from this disorder. Now, I come from Newark, New Jersey, and I believe the population of Newark, New Jersey is 275,000 people. Now, you compare that to the people who have gender identity disorder, that number is dwarfed just by the population of my own city. So the actual prevalence of people who have this disorder, number one, is not that significant. It's not that statistically significant, number one. Number two, the number of people who actually go through with the disorder is even less than that. And the number of children who actually present with this disorder and who want to go through the process of changing their sex is even lower than that by orders of magnitude. In fact, the doctor who was quoted in that Huffington Post article, I believe his name was Dr. Spack, who runs a sort of medical facility that allows children to transition from one gender to another, states that he's only averaging 19 patients per year. 19 patients per year. And that the average class size of my high school, of my high school class was at least 20 to 25. I mean, and he's talking about treating only 19 children per year. Per year. So when you state that this is prevalent, that's not at all true. Not true at all. Now, let me quote something from, I believe it was either the Huffington Post article or from Dr. Spack's actual medical report. Because, like I said before, I didn't just read the Huffington Post article that quotes Dr. Spack. I actually went and found his medical report that was based on a study that he conducted, and I read that medical report. I didn't read the medical study, but I read the medical report. And this is what the medical report says. The report details 97 girls and boys treated from 1998 and 2010. So that's only 97 children in a 12-year span. The youngest was 4 years old. Kids that young and their families get psychological counseling and are monitored until the first signs of puberty emerge, usually around 11 or 12. Then children are given puberty blocking drugs. Not hormonal treatment that is irreversible, but the puberty blocking drugs that are reversible. And since I actually read the medical report that Dr. Spack wrote, I know that there was 98 children who he treated, but only 97 children went ahead with the sort of irreversible hormonal treatment. So again, this shows that this is not a usual case of childhood gender switching, but is actually gender identity disorder, because 99% of the children he's treated have actually gone on to change their sex. They've actually gone on to completely and permanently change their sex and change their gender. So again, this is 97 out of 98 of the patients he's treated. So now let me go into point number 4. In your video, you said that, children were too young to understand. A child at 5 doesn't understand the implications of changing his sex. He hasn't lived long enough as a boy or a girl to understand, what's going on with his body, or to have, the rationality or the cognitive abilities to understand what he's going through. So I've already talked about how this, we're not talking about 5, 6, 7-year-olds who permanently alter their sex. We're talking about children at 11 or 12 who are given puberty blocking drugs, number 1, and 2, are not given actual permanent biochemical altering drugs until they're 16. So there's a huge difference between a 5-year-old and a 16-year-old. That's number 1. But number 2, there are 3 phases to this sex change treatment that Dr. Spack specializes in. The first phase is the diagnosis. And you must be seen by a health professional. You must be monitored by a health professional. And then only after you've seen by a health professional who specializes in gender identity disorder can you actually be diagnosed with it. So there's certain medical and psychological steps that need to come before you can even be diagnosed with gender identity disorder. And you have to remain in psychological counseling for years, right? So it's not just some, 5-year-old kid who says, who's a boy, but then says, I'm not a boy, I'm really a girl. These are children who have actually been in psychological counseling for years and have actually been diagnosed with gender identity disorder by medical health professionals who specialize in this field. So we're not talking about 5-year-olds here. And we're not talking about 5-year-olds who just one day come out and say, I don't want to be a boy anymore, I want to be a girl. So we're not talking about that. The second phase of this sex change treatment, like I stated before, is puberty suppressant drugs. These children remain in psychological counseling until they're 11 or 12 years old, at which point they're given the puberty blocking drugs. And again, this is completely and absolutely reversible. Completely and absolutely reversible. That's the second stage. The third stage is the actual hormonal treatment that will lead to the permanent changing of their sex or their gender. And again, A important condition of this sex treatment is that they continue to be in psychological counseling. And the hormonal treatment is only administered at 16 years old. So again, we're not talking about children who are 5 years old. We're talking about 16-year-olds who are making the decision to permanently alter their sex by taking drugs that alter their biochemical hormonal makeup. So again, there's a big difference between a 5-year-old and a 16-year-old. So now let me go into point 5. You made another point in your video when you stated that, what if there was a black girl who wanted to become white? And let me just say, this is totally different. This is not at all a similar situation. Race and gender are not at all comparable. They although people tend to create this sort of superficial equivalence between race and gender, they're not at all the same. And the way they get produced and constructed and the way that human beings express them are completely different. So let me explain why. A person who wants to change their race does so because of external factors. They don't do it because there's internal factors within themselves. They do it because of external factors like racism or segregation or discrimination. So it's not something that's internally driven. It's not something driven by their biological makeup or within themselves. It's something that's externally driven. Now, this is different from gender. Gender identity disorder is a psychophysiological condition. It involves both your psychology and it also involves your physiological makeup of your actual body. Gender identity disorder is internally dependent. It's dependent on your biology, it's dependent on your physiology, and it's dependent on your genetics. Now, there's been research conducted, and there have been studies conducted which show a link between brain structure and gender identity. In other words, men and women actually have physically different brain structures. And your brain structure is integral to how you perceive your own gender. And it's integral to the actual biological makeup of your gender or your sex. That's what the research has shown. That there's actually a link between your physical brain structure and your gender identity. Now, there's no relationship. And this is different from race because there's no relationship between your biology, your physiology, your genetics, and the way you perceive your racial identity. In other words, there's nothing about your brain structure or your physical body that determines how you perceive, and that's the most important point, how you perceive your racial identity. There's no doubt that people who are black and people who are white genetically are different. I mean, that's why our genotypes are different. That is not our genotype. That's why our phenotypes are different. That's why our skin, African Americans have black skin, and white people have white skin, whatever. But there's no link between your biology and the way you perceive your racial identity. It's completely socially and culturally constructed. So there's a difference between internally driven and externally driven factors that differentiate gender identity disorder between from another person who may want to change or who say they want to change their race. Again, wanting to change your race is not a physiological or a medical condition. No one can say they were born the wrong race. That just doesn't make sense. You can't. There is no medical condition or psychological condition in which a person can feel like they were born the wrong race. There's nothing in your biology that produces a psychological or a cognitive dissonance between how you feel on the inside and what your actual physical body looks like. That's completely externally driven. And even if a person were to say, I feel like I was born the wrong race, and there are some people who say that, They feel like they were born the wrong race. There can be no medical or biological basis for that statement. Why? Because there's no biological basis for their self-perception that they were born the wrong race. Again, it's socially and culturally constructed. Wanting to change your gender is an actual medical condition that's been documented and is diagnosable in the DSM. It's an actual psychophysiological condition where your biology it's dependent on how your biology produces a certain perception of yourself. And this comes out very clearly. If race or racism didn't exist, then you wouldn't want to change your race. If there was no racism, if there was no segregation, if there was no discrimination, if there was no difference in how different races were valued in society, there's no reason why you would want to change your race except for cosmetic reasons, which is not at all comparable to gender identity disorder. Now, if we didn't have a conception of gender or race, or if we had a different conception of gender or race, or if gender or sexual orientation discrimination did not exist, there would still actually be a medical condition where people would experience a cognitive dissonance between what they believe their gender is and what their actual physiology and biological makeup would be. So that's the difference between race and gender. Now, point 6. In your video, you also said that if you had a child who said they felt like they were born in the wrong, body with respect to their gender, you would tell your child that they were delusional, and you would tell your child you said that they would need to be corrected. And quite honestly, that's bullshit. I mean, it's just bullshit. Like I said before, gender identity gender identity disorder is an established psychophysiological medical condition. That's what it is. And if you tell your child that, they're delusional, or, if you think that your child needs to be corrected, it's been, I mean, there are studies that prove this. There's documented cases that when this occurs, it is absolutely psychologically damaging to the child, and that they become more susceptible to depression, more susceptible to anxiety, more prevalence for suicide, and that they're more likely to engage in acts of self-mutilation. That's just proven based on scientific studies and research. Now, let's imagine that this example that you give of, telling your child that they're delusional if they believe they were, born in the wrong, body with respect to their gender. Imagine if your child was homosexual. Would you tell your child, you're not really homosexual? Men are supposed to be sexually attracted to women. And if you're a boy, and if your, child is a boy, and, they tell you that they're homosexual, there's no way in hell that you would tell your child, you're delusional. You're delusional. I mean, because then you would have to believe that all homosexuals or all lesbians are just delusional. And likewise, you'd have to believe that transgender people, that they don't actually have a psychophysiological condition, that they don't actually have a medical condition, but that they're just delusional, that they're just confused and they're delusional, which again is just, bullshit. Now, in terms of gender formation, there are no and this is just a fact. To me, this is just an indisputable fact. There are no objective standards of gender. None whatsoever. There's no rational argument that you can make. Now, there are religious arguments. Maybe you think that there's some moral arguments, but even those moral arguments have to be predicated on some form of rationality. So maybe there's some religious arguments, but there are absolutely no rational arguments. None. Let me say that again. There are absolutely no rational arguments for why a person born with the physiology of a man is obligated to live as a man. None. None. No rational arguments that you could possibly produce which say that if you're born as a man, then you have to live as a man. None whatsoever. So those are just my 6 points of clarification that, caused me to, do this video response to Hugo Strange. And Hugo, if you're watching this, I hope you understand why I felt like I had to do this video response in order to clarify certain points of misinformation that were in your video, and certain things that were just not factual what you stated. But like I said before, Hugo Strange, still my boy, and still think he produces awesome content on his channel. So this was your boy Uber Hikari, aka the Nerd Nigga. Just brought you another video with no frills, just the analysis. Peace, and have a blessed day.